Call the regular meeting of the Lakeshore Hospital Authority Board of Trustees to order. I need staff or trustee addition or deletions to the agenda or consent agenda.
Mr. Chairman, staff would like to request that the board approve the addition of the Thursday, June 2nd, 2022 minutes to the consent agenda. That would have been the FGC presentation.
That the consent agenda. No others, I'll entertain a motion to adopt the agenda.
Second.
We've got a motion and a second. All in favor, signal by saying aye.
Aye.
All opposed, that motion carries. Public comments, and again, these public comments will be for the regular meeting. Have a time for public comments for the special meeting during that meeting. Comments, anybody on the Zoom meeting? Seeing none, we will, I'll entertain a motion to approve the consent agenda.
Second.
Got a motion and a second, all in favor, signal by saying aye.
Aye.
All opposed, motion carries. New business, fixed asset inventory for Lakeshore Hospital Authority.
Thank you, Mr. Chairman. Obviously, the majority of people here tonight are here for the special meetings. I'll try to move through these items as quickly as possible. The first item is the presentation of the fixed asset inventory for 2022. There were only two changes from the prior year. In those cases, we removed two items because they become obsolete or broken, and we added the two items that replace them. Given that those are the only modifications, staff requests that trustees approve the inventory as presented.
Motion to approve the requested changes to the fixed asset inventory.
So moved, Mr. Chair.
Second.
Got a motion and a second. All in favor, signal by saying aye.
Aye.
All opposed, motion carries.
In your regular meeting in February of this year, I requested permission to bid hospital security services. The purpose in doing so, and the purpose of my request was, we had received a request for an increase. The contract that we were working under was actually a contract that we had assumed from CHS when they decided to leave. Therefore, it was not something of our own work product. Part of the process in bidding is to determine who the bidding pool may be. And what we were able to determine very quickly is, number one, there's not a lot of there's not a lot of security services here local. And of the ones we could find, there were huge staff issues and shortages, and we became concerned about the ability to provide the service. So having looked at it from that level of information, we looked at what others in commercial and industrial type settings were paying for similar services. There is a schedule in the agenda packet which shows that result. And after having looked at it, it appears to me that we're in a better position if we can simply negotiate a rate with our current security service provider. And what they have agreed to is our current site supervisor hourly rate is $16.94. The new negotiated rate would be $19.60. The security officer rate is $14.84. It would go to $18.20. Now, this not only includes an increase for the personnel, but it includes the increase for the match and et cetera. Based on the survey, I simply don't think the trustees can do better than that. And I think if you try, you're running the risk of having an inferior service due to staffing issues. So staff would recommend that we accept the negotiated rate as stated.
The wishes of the board.
I move that we accept the recommendations, Mr. Wayne.
Second.
Second, any further discussion? All in favor, signify by saying aye.
Aye.
Opposed?
Speaking of staffing issues, as you are aware, we sometime back created, we actually had two positions for maintenance at the hospital. We reduced one of those to a part-time position. However, we've simply not been able to fill that position at all. So in talking and discussing this with Dwayne, we would at least like to give it a try by making it or returning it to a full-time position and increasing the offered rate of pay from $12.50 an hour to $18 an hour. Dwayne and I have talked. I don't know that we're going to be able to fill that position even by making these changes. If not, I will continue to let Dwayne use contracted labor and et cetera in order to assist when needed. But it would be nice if we could find somebody to actually put on staff. But I just don't want y'all to think that this is the cure-all, because we're having the same problems that most people in the industry are having filling these type positions. Nonetheless, we would like to try, so we are requesting the changes to the building attendant job description and ask your approval.
Wishes of the board.
I just lost a director to Walmart Fulfillment Center for $18.50 an hour. I don't think the price is outrageous. What it's worth. Deal.
Got a motion.
Yeah, that's
Second.
it's my anger emotion.
Got a motion and a second. All in favor, signify by saying aye.
Aye.
All opposed? Motion carries.
And of course, my last item, as I think most of you have been made aware, our attorney, Fred, has resigned his position effective November. Fred has indicated to me that if we find somebody sooner than that, he'll be glad to step aside or to help train, acclimate them to what's going on in the hospital authority. We need to kind of discuss where you would like to go from here, how you'd like to proceed. I can tell you that I think we've all expressed an interest that our good friend Fred Sr. maybe step back in, but I don't think that's possible. I have also reached out to our prior attorney, which was Mr. Fiegel. He is not interested. So I think we're probably looking at a new attorney or a new way in which to contract for legal services. I don't want to put any pressure on Fred. I know that Fred's willing to do anything and everything he can to help, but I think he would probably feel better as long as he knew we had a plan moving forward. And so with that, I'd like for you to start thinking about what you might like to do and how. And we can certainly agenda this at the next meeting and come up with a final plan, but I think it's here on us. And the only thing I would say is whoever you select, we need to make sure that they have some background in special districts, if at all possible. People associate us with government, but they don't realize we're a little bit different in that we are a special district and there are laws that are different for us, even though you may not notice them from the outside looking in. But having said that, we got to start thinking about it. We're not going to be able to get a Fred Sr. We're not going to be able to get a Marlon with prior experience. We're going to have to look at doing something different.
I was just going to mention that's only 5 months away,
Mhm.
and we can't ask you to maybe reach out to some of the local
Sure.
surrounding
Absolutely can.
firms to inquire,
Would
and maybe
you,
with the help of Mr. Coberline,
Would-
Junior.
We can
Senior.
issue an RFP
Yep,
and see what you get back in solicitations, that type of thing, if that's your wish.
that's only 5 months from now that we would have his services.
And now would be the time to start with that process, issuing an RFP.
Yeah, well, there's a hole out here. I mean, Fred's leaving the hole. I mean, he did a lot of this work. So, you know, you got the city of Lake City, you got the town of Fort White, you got numerous communities.
Live oak.
They're all gonna be looking.
Yeah.
They're all gonna be looking. So,
I think we should move on it.
okay. With those comments, and staff would recommend the trustees approve the issuance of a request for proposals for legal services for the Lake Shore Hospital Authority. That would be our recommendation.
So moved, Mr. Chair.
Second,
Motion and second, any further discussion? All in favor, signify by saying aye.
Aye.
All opposed. Motion carries.
That's all I have.
Unfinished business. That report is included in your package in the packet. Board member comments for this section.
whatever happened to our dental assistant thing?
They are waiting on us, Miss Laurie. Last conversation was approximately a week ago. We still have an opportunity, hopefully, to work something out with the health unit. But until some decisions are made about buildings and potential locations can't be determined. So I think maybe according to the chair, when we hear Meridian's presentation tonight, we're going to try to set up a date we can start talking about those things. Still in play. It's still in play. I'm good.
So what we will do is we will adjourn this meeting. We'll have a brief 3-minute break. And we will come back in just a few minutes once we get that tape switched over. This meeting will be adjourned. All right, I was muted, so I will repeat myself. Purpose of the special meeting is discussion and to take possible action on the statement of interest proposals, the second offer from parties interested in utilizing the Lakeshore Hospital campus, all or part, to provide medical care or other services to the citizens of Columbia County through a partnership with the authority. We'll do like we did in previous special meetings with the proposals and accept public comments after the presentation. So if there's no staff addition or deletions to this agenda, we will move forward with the presentation from Meridian. Or
Thanks, Chair. So I've come before you guys a few times now, and our presentation hasn't substantially changed either from 2019 or what we submitted with our SOI and RFP in February. Answered a bunch of questions, kind of gone through. What I thought I'd do tonight, though, is bring forward a lot of details. I brought my team with me so that we can try and answer your questions on the spot, and anything we can, we'll take back and carry forward. So I'm just going to introduce my folks real quick. First is Shoa Basha, Special Assistant to the President and CEO. Teresa Jenkinson, she's our CFO and Senior Vice President. Our Chief Clinical Officer, Richard Anderson. Richard's been with Meridian 40 years, and this year we're celebrating our 50th year. People go, wow, but we have a lot of longevity with Meridian. Richard's up there, but we got a few, and we're proud of that because we are part of the community and our staff. It's more than a job; it's their mission, and that carries a long way. And last but not least, our Executive Vice President and Chief Operating Officer, Lauren Cohn. So y'all have heard from me now several times. So what I thought I'd do is take a seat and let Lauren take you through the details and particulars. And then I'll jump back in when you need me and answer any questions and go through really some of the proposal pieces, if that's okay with you all. Lauren?
Yeah. Thank you. Good evening, everyone. So as Dawn mentioned, we are celebrating this year 50 years. So I thought I'd take the opportunity to start off by telling you a little bit about who we are at Meridian and some of the services that we offer, and then work through some of the details on the proposal we have for the hospital. So we've been providing services in North Central Florida since 1971. Richard obviously started when he was just a child back then. And he is our resident expert on clinical services. This diagram kind of shows some of the services that we offer, the full continuum of care. So we've got services on the education and outreach end, prevention, co-responder teams, where we've got our clinical staff partnering with law enforcement to respond to calls that have mental health needs. Homeless recovery services and diversion and recovery. We also have crisis intervention, substance use inpatient, and mental health inpatient. So on the very acute end, we've got residential treatment services, medication assisted treatment. So if you're not familiar with that term, we've got methadone, buprenorphine, Vivitrol services in partnership with clinical services. We do case management, primary care, and as we'll talk about, we expanded our primary care here in Columbia County just last year, responding to the ever-growing need and requests for that service. So we've started to do that here. We also do case management and some community-based services for the criminal justice population. In mental health, we do love acronyms. So you may see some acronyms throughout here. We've tried to kind of break those out and explain a little bit more about what those services are. We also have the supportive services. We operate a program called SSVF. As I mentioned, we love acronyms, but it's supportive services for veteran families. So we do provide that case management and housing and support for veterans. We also do care coordination, supportive employment, and psychosocial rehab, where we work on skills training and teaching individuals that have mental health needs, those independent living skills, job skills for job placements. That's on the supportive service end. We provide services utilizing a lot of different evidence-based practices. Our services also address social determinants. So what that means is we're looking at the whole person. We're taking everything into consideration, not just their mental health needs, but any additional social needs they may have is related to skills, training, work, reintegration with their family, child welfare, those kinds of needs. We're currently in 13 counties providing services to residents in almost all of Florida, but our outreach and treatment services touch over 36,000 individuals annually, and we provide over 430,000 services. For last year, our expenditures were at 55 million and we employ 650 individuals. But for this coming year, for 2023, we are at 61 million. So we're continuing to grow and expand. For licensing and accreditation, we have a lot of experience with various oversight entities. So just to highlight some of the ones we work with, we are accredited by CARF, the Commission for Accreditation on Rehabilitation Facilities. And we've been accredited for over 17 years in our behavioral health programs, as well as our opioid treatment programs. We had a survey last year, our most recent survey in 2021, and we got very high feedback, very high marks, and received the best possible outcome, which was a 3-year accreditation. We hold active right now 55 substance abuse licenses granted by the Department of Children and Families. You can only imagine what that annual renewal process is like for those 55 licenses, but we've got it down to a science now. We have 6 licenses granted by AHCA, the Agency for Healthcare Administration. We have crisis stabilization unit licenses, residential treatment facility licenses, and 2 healthcare clinics that provide the license for our primary care services in Gainesville as well as Lake City. So community needs. So that's a little bit about who we are and what we do. Now, some of the identified community needs. In 2019, Well Florida did community needs assessment. And in their report, they said that in 2017, Columbia County residents visited emergency rooms for mental health reasons at rates higher than those in the state as a whole. So we're looking at an increased need for mental health services. According to Mental Health America, nearly 2.9 million Florida adults, 17% of the population, have some form of mental illness. And I think we all know that over the last 2 years, due to many reasons related to the pandemic and additional stressors, we've seen an increase in people seeking help for mental health services, particularly for anxiety and depression. We have letters of support in our proposal, I'm sure you saw, from the Department of Children and Families and Lutheran Services Florida, as well as Well Florida, who conducts their needs assessment of community mental health needs. In Columbia County alone, we serve as the central receiving facility currently for outlying regions as well. And we plan to expand the best practice model that we have here in Columbia County to Alachua County. We're also planning to open a 16-bed residential treatment facility in July of this year, which would provide another level of care that residents in the community have been asking for, especially as potentially a step down from state hospital or a diversion of allowing people with mental health needs to have a place to receive treatment and coordinated care. We also, like I mentioned, we added primary care services, and we're just continuing to expand and grow that practice here since we started in 2021. The next slide, hopefully you'll see, highlights some of the services we've provided to Columbia County residents. Again, this slide is exclusively residents of Columbia County. And you can see, I think some of the numbers have been quite staggering. We have 582 adult county residents received acute care inpatient crisis stabilization unit services. Kids over 180. For psychiatric, when we say psychiatric, that's medication management, seeing a nurse practitioner or psychiatrist for medication needs. We've got 895 adults and 200 children. So I think those numbers we continue to see increase over the last couple of years. Medication assisted treatment, as I mentioned earlier, we have 290 individuals that have received services from this county this year. So that's July 2021 through May 2022, so this fiscal year so far. That's not even a full year, and those numbers I think are pretty surprising when you see how many individuals of the county are accessing those services. The next one, we've highlighted some of our client outcomes, as we call it. We, as part of the services that we provide, we monitor and assess how well people are doing, how they're getting better. It's not enough for the services to be provided, but they have to be effective. So we're constantly looking at what are people saying about their experience in our services and how people are reporting that they feel as a result of our services. So 75% of adults and children who receive services with us report improved functioning and a reduction of symptoms. They're feeling better, they're getting better. We are also seeing that 95% of individuals who receive services with us say they would return to Meridian if they experience the same behavioral health needs in the future, which is saying quite a bit. You know, some folks don't always enter care in a voluntary manner, so it's really, I think, means a lot more to see 95% of those individuals report that they would come back. 96% say treatment was helpful, 94% say they've become more independent, 96% feel that our staff truly care if they get better, and 96% would recommend Meridian to others. So that's from our client feedback surveys that we conduct across all of our levels. So Meridian at Lakeshore Hospital, approximately 117,000 square feet of planned space we have laid out here, and I'll kind of detail our proposal for use. Meridian, we plan on utilizing the hospital building and surrounding grounds for a continuum of care and to expand and meet the ever-growing needs of the community. We have outlined staffing allocations as well as an operational plan here, and we don't anticipate or have any current limitations or restrictions on using this space. So I know the part everyone is really excited to hear. What are we going to do with it? We've got our first floor plan, and I'll kind of detail what these are, but we allocated staff and visitor cafeteria and a patient kitchen, emergency crisis stabilization unit services, an addictions receiving unit, and psychiatric and emergency receiving. For those of you that are not in mental health, I'll kind of explain what these levels of care are and what they mean. So on the first floor, we've got our psychiatric and addictions crisis receiving. That would be moved from our current campus where we operate our receiving facility. We've got the reception for Baker Act clients on an involuntary commitment, Marchman Act clients, as well as any voluntary walk-ins for individuals seeking mental health services or in crisis. So that's where we receive them and do an assessment and thorough screening and connect them with the services they need, whether that be inpatient or referrals or warm handoffs to any of our outpatient services. Our emergency crisis stabilization unit, adult and children wings, that again would also be moved from our current campus. We have an expected number of 30 beds, and the average length of stay for this type of facility is about 3.5 days. So a crisis stabilization unit is an inpatient facility that provides short-term and crisis stabilization to individuals experiencing some type of mental health crisis. It is a short-term program after which we connect individuals with long-term follow-up care, either inpatient, residential, depending on their needs. Since we already have that service, we would be ready to transition that and move our current license. Also on the first floor, we have an addictions receiving unit laid out. An addictions receiving unit is a medically supervised, inpatient, short-term acute care, detox and stabilization facility for adults with significant substance impairment or some type of co-occurring mental health and substance use disorder. The average length of stay for that program is 5 days. This would be an entirely new service. So we currently operate an addictions receiving facility in Gainesville, but we do not have one for Lake City. So we'll be very excited to offer that service and establish that program here in Columbia County, as currently any residents of Columbia County have to go to another county, Alachua, to receive that level of care. We would also be bringing our primary care and expanding our primary care from our current location to this location, and bringing a pharmacy. While Meridian doesn't operate a pharmacy ourselves, we partner with Genoa, a pharmacy who partners with behavioral health agencies and provides on-site pharmacy services. So our plan would also be to include that pharmacy here on Lakeshore. We would operate this weekdays with 24-hour, 7-day on-call physician support and medical support for patients on the units. So oftentimes through our primary care and pharmacy, we have providers on call that are always available through our inpatient. So having them co-located, I think would just make that a little more seamless for any patients enrolled in care. Then we've got the staff and visitor cafeteria and patient kitchen, which is really quite something. I think it's really a huge space, and we would be excited to be able to do a lot with it to offer food to our current programs as well as our staff. So that's the first floor. The second floor, we've got outlined a short-term residential treatment, a forensic residential program, and some counseling offices. So when we say short-term residential treatment, often the acronym is SRT. That's an adult inpatient unit providing services to individuals with mental health needs or co-occurring substance use needs. SRT provides a high level of care for individuals who are no longer experiencing maybe a psychiatric emergency, but who are still in need of additional inpatient treatment prior to transitioning safely back into the community. It also serves clients waiting for placement at the state hospital. Right now, some of our crisis stabilization unit beds are occupied by folks waiting transition to the state hospital because of waiting lists and time it takes to get into those programs. So having an SRT would essentially allow a little more movement here in Lake City, Columbia County, through the mental health kind of continuum of care. We also have outlined a forensics residential treatment program. So some of you might be saying, what's a forensics residential treatment program? And that is a residential treatment program for individuals not only with mental health needs, but some involvement in the judicial system. So the program provides a less restrictive environment than state hospitals, and also assists individuals with safely kind of returning and reintegrating into the community. So it could be a diversion or a step down program. The average length of stay would be maybe 3 to 6 months. And then we've got some counseling offices allocated to that. The third floor, we have outlined an inpatient psychiatric hospital level care. So that would be a largely self-contained wing. This would allow us to receive and treat Medicare patients. And presently, we do not have a psychiatric hospital in this region. So Medicare patients have to go out of county for that level of care. So this would be bringing the level of care to county residents and allow for folks to stay within the county residence and allow their family to participate in treatment a little easier than traveling, which isn't always possible for some of the families that patients we serve. And then our fourth floor, we have the space for a lot of our outpatient and community-based programs. So we've got our mobile response teams. Presently, we operate mobile response teams out of our current campus, so this will be moved to this campus. Mobile response teams respond to calls in the community when someone is in a mental health crisis. So they go out, they do an assessment and determine what services are appropriate for an individual and help coordinate them safely to that level of care. We also have our community action teams. Those are wraparound services that have counseling, mentorship, nursing, provider physicians that provide that wraparound service to individuals who are under 25. So we've got those action teams that go out and kind of wrap around the family to provide education and resources to the parents, as well as clinical services to the child. And we've got some clinical administration and our supportive services for veteran families, as I mentioned earlier, where we provide care coordination as well as housing services or assistance to veterans and their families. We are a certified community behavioral health clinic now, as we recently obtained a grant. So we provide services as a part of that. As I mentioned, you'll see all the acronyms next to them. You know, again, we love an acronym, but I won't spend a lot of time going through the acronyms. I'll just kind of tell you an overview of what the programs provide. So our certified community behavioral health clinics and our community mental health centers provide wraparound services to individuals who are at risk of hospitalization. So what we sometimes call high utilizers, individuals that are frequently on an inpatient unit. So in an effort to keep folks in the community and provide the level of care that they need, they may be connected with these programs. So we've got that 4th floor allocated for those types of programs.
Can I jump in?
Yeah.
So you may ask why some of these outpatient programs to the hospital. If we look at mobile response, supportive services, certainly CCBHC and CMHC, a lot of them interact in an outpatient capacity with high need, high utilizers that come through the inpatient. So the ability for us to go downstairs, work with them, coordinate with their families, provide those services, gives that warm handoff while they're discharged. And so it's real important that whether we first engage in the community or we engage in the hospital, that we provide services beyond the 4 walls of the hospital to the community. A lot of programs such as medication assisted treatment will stay back on our Rishi Avenue campus, and we are expanding residential facilities there as well. So these are programs that are specifically tied, in my opinion, in our opinion, to coordinated care, to slow down readmissions, to engage folks post-discharge from hospitalization far more quickly than we could if it's, will you follow up with an appointment 7 days from now, 10 days from now.
Yeah, no, that's an excellent point, as it is some of the programs that we've mentioned, especially the programs targeting children and families. We work right now to do a warm handoff with those families when the child is first an inpatient, so we can prevent a future subsequent hospitalization and wrap around that family and provide them what they need on that initial encounter. So that's an excellent point, John. Thank you for adding that. And I think as we talk about this, we've really started to outgrow the campus we now currently have on Michigan. We are, I think, full to the brim and expanding and adding a new residential program. We just continue to add services. We hear a growing need and we try to find a way to meet that need regardless of space. But I think we're at the point now where we're getting a little stuck. So we want to continue to grow and expand and bring additional services to Columbia County. So you'll see on the next slide where we talk about kind of community impact of this proposal. As I mentioned, we would be providing hospital level psychiatric care, which is not provided in this county currently. So just to reiterate, this would allow individuals needing this level of care to remain in county and have their families more involved in that care. We plan on bringing over 86 current positions from our Lake City existing campus. But this proposal and this plan would add an additional 98 positions for personnel for a total of 184 positions for Meridian at Lakeshore. And then a grand total for Columbia County of 252. And then we would be addressing the growing need for substance use treatment through an addiction receiving facility, not currently provided in this region. So I think that would be a really much needed service for the county, since currently when we receive folks that need that level of care, we have to get them to our facility. Oh, so this, yeah. So this personnel includes clinical staff, all of the inpatient staff. We've got nursing, LPNs, RNs, mental health techs. It also includes substance or addictions physicians, as well as psychiatrists, either psychiatrists or nurse practitioners. It also includes counseling, discharge planning, screening staff to do those clinical assessments, as well as all of the dietary facilities, housekeeping level staff that are required for these types of programs. As we've seen too, we've seen a for suicide prevention services, and we are an accredited suicide hotline, and we would be bringing that here as well and doing that front end suicide prevention when we take those calls. So that would be something that we would enhance the plan as well. And so that's a little bit, or a lot of it maybe, about what Meridian does, what services we offer currently, what services we plan to offer, and how we're proposing to use this space. Are there any questions on that piece before I pass it off to our fearless leader? Are there any questions on anything that's heard so far?
Just one, just where I understand the facility on, should this come to fruition, the facility on Michigan Street will house what services?
That's a good question. We are going to continue to operate a youth residential treatment facility that we currently operate there. We're planning on opening and expanding a residential treatment facility for adults in July. We have our medication-assisted treatment programs that will continue to operate out of that location, as well as some of our outpatient counseling and medication management outpatient services.
Dale, to answer that a little bit more complete, our CSU in Lake City, it's very compressed. We keep updating it, but it's been around for a long, long time. The needs are great for growth, and that's why we see Lake Shore as an opportunity for growth and expansion. We have a lot of acute folks in a small area. It can be difficult. There's those, it's age, it's been there for a very, very long time, which you probably know.
I do.
So it gives us the opportunity for day rooms and expansion here, so that we can decompress, we can bring down the level of acuity.
Okay, just a quick question on employees. If I did my numbers right, you currently have about 150 employees. And you're gonna bring 86 over to the hospital, over to that building, you're gonna retain 66. And you're gonna add about 100
Yes,
of new employees.
yes,
That's rounded.
yes,
Okay.
that's correct. I had to bring my numbers back up, but yes, that's correct.
If I can follow up on Mr. Powell's numbers, the 86 that you currently have and bringing the other 98 is 184, but where do you come up with the 252 for Columbia County?
68 or Bay.
Yes.
Say that again?
There's still 68 down in Michigan Street.
Oh, okay. I
And
thought
they
that
will
was bringing over the 86 from Michigan Street.
We are
That's-
bringing over 86, but 68 will stay there.
Oh,
So
I
we'll
got you.
continue to operate.
So meaning a total of 250.
Yes.
Okay, good.
Yeah,
Mr. Chair, if you can help me out on the floors, I've been trying to follow you. Excellent. I appreciate this handout. It's very detailed and involved, but if you can walk me through again on the floors, the number of beds that you're anticipating on each floor.
sure, yeah.
Please, I got a little confused on that.
Okay, on the first floor, the psychiatric and addictions crisis emergency receiving doesn't have any beds necessarily. We would be receiving folks, screening them, possibly doing 23-hour hold, but no beds allocated per se. Crisis stabilization, we are expecting 30 beds. Our current campus has a license for 28, but with room and growth, we would go to 30. Our addictions receiving unit would be 10 to 12 possibly. So that's how many beds would be allocated there.
But we could ramp that up and down based on need. So that's kind of what we see right now from the region that we serve.
So that's between 30 and 42 beds on the first floor.
Yes.
Okay, and then on the second floor,
On the second floor, we've got SRT with 16 to 20 beds, minimally 16, depending on need to go to 20. And then our forensic residential would be 30 beds.
so again, we're up close to 50. Okay, that was the figure that I had.
Yes,
And then on the third floor,
the hospital level. We go 30 with that 30.
Yeah, we have
I'm
that
sorry, I thought we
number.
had that in there and I don't know what happened. It was 30.
30 on the third,
Mhm.
and then 15 on the fourth, I think is what you had anticipated.
Oh, on the fourth floor, there would be no beds. Those would be kind of counseling, community-based services
On the fourth
on the
floor.
fourth floor. Mhm.
Okay, even so where it says here patient bed, it's not a patient bed there, or maybe,
Oh, this
That's
is,
your map.
this is the current
Excuse me?
map. I'm sorry,
Oh.
these are the current floor plans.
Uh-huh.
So how it was last being used.
I got you. So there wouldn't be
Yes.
any beds on the fourth
Right,
floor.
right.
Okay. Before you get into the last part, where you say 13 counties that you're currently serving,
Mhm.
how big is the facility in Alachua? How many beds are in Alachua County?
We have 66 residential treatment beds.
66?
We've got 30 CSU beds.
Okay.
And 10 addictions receiving beds, 12.
12, okay. And
Plus
then
the
what
motel
other,
that's attached to us with 39 beds. It's not a treatment facility, but providing housing to someone that's in crisis versus sending them back into an environment that's not supportive.
okay,
Or pretty much, very few people pay for those, the motel we bought attached to our campus, but safety is important to get someone a good start.
okay. And what other counties do you have a facility similar to Alachua County?
So from an inpatient standpoint, sorry.
No, that's
You
okay.
sure?
No, I just look at you like, who's getting it? Go ahead.
So from an inpatient standpoint,
Correct.
these are the two locations that we have.
These are the only two in the 13, okay.
But we have offices in all the other counties. And when you look at history and expertise, we're also partnered with another organization called Lifestream Behavioral. They operate out of Leesburg, but they support Sumter, Citrus, Lake County, Orange County, a couple others. They already have 2 psychiatric hospitals and CSUs in those facilities. And we're both affiliates under a parent organization where John Cherry and myself are the CEOs of that parent organization. So while we do all the services that we're looking to expand, we also have the expertise in the hospitalization with our partner to help us make sure we get it right.
Okay.
And they've been doing it for many, many years in Leesburg.
And I think on your plan here, I think you said was it the first floor where you're gonna house the Baker Act Marchman patients?
Yes,
And that's a total bed unit of
30.
30.
30. What is it
Well, the
currently?
Marchman would be another.
Addictions receiving would be.
Guys are hearing, I'm sure it's all over.
What is it currently on the Michigan street?
We don't have an addictions receiving, and we have 28 beds on Michigan.
But there's no Baker Act
We have Baker Act 20,
Right.
28 beds.
there?
If you, yep, in Michigan, if you have a need for addictions, we'll assess you here in town,
Correct.
but we have to put you in a transport you down and serve you out of Alachua County.
Okay.
Big deal when folks have family that are engaged or supportive and you need them as part of discharge planning and really ongoing support. Another stat that I think is really important, we look at our readmission rate very closely. For Medicaid, we do a lot of Medicaid business. About 42% of our business is Medicaid. It's privatized here in Florida. Another 40% is indigent care. But in talking with Centene, which is the largest, the Sunshine Medicare plan, the average in the state right now is about 34% readmission rate for Baker Acts for adults. We operate at 11% readmission rate. That means we're able to coordinate people out of the hospital and keep them out of the hospital with our full continuum of care. Pretty darn proud of that, and it's made us one of the premier providers for the plans, even to the point where they are subsidizing for their members our primary care. So they have give us PMPM to manage primary care coordination, and other things for their members, because they know we can make a difference, a positive difference.
What is the average stay on a Baker Act?
About 3.5 days. So it's an odd curve. You'll see some folks that are not even there 24 hours. They don't meet criteria for in-depth voluntary examination. If you come in on a Baker Act, you have to be seen by a psychiatrist to be released. Lauren's going to tell me at July 1st that changes, and with protocols and APRN can do that. So you'll see some folks released, and then you'll see the 1-2 days with a high number, and then it's got a real big tail to it. Some folks are there for 7, 8, 10 days. We have folks that are there for right now for close to 6 months, waiting for placement at state hospital. They get converted to a BA8 or BA32. BA8. So we petitioned for that. And, it's really is that curve with the tail. Trying to manage folks as safely as we can back in the community.
Thank you.
Without impinging on their rights.
Appreciate it. Thank you, Mr. Chair.
Thank you so much for.
So I asked Lauren to talk a little bit about the services that we already have in the county. I said this to you guys before when we got together. One of the challenges I see, and I've worked in about 36 states as a consultant, 14 years for behavioral health. By the time a group like yourselves or the county commissioners sees a need, often we're priced out of the ability to come in and provide that. And it becomes really difficult. So I really see the hospital here at Lakeshore, similar to what we've seen in Orlando with Spire Health Systems. They're operating out of a hospital system, hospital building. We've seen it in Pensacola. I've seen it in quite a few states. Providence, Rhode Island, Fort Wayne, Indiana, Pennsylvania. The model that we're talking about really is sort of a model that works and aligns with the growth of the county and the region. I mean, I understand that y'all support or supportive of Columbia County, but regionally, this is a hub. And while Meridian is growing and we're expanding to meet the needs, you know, we're now in Baker County. We just purchased property in Marion County and Putnam County based on need, and we're growing in those areas. We can grow out, but we also have to grow the center of excellence up within our hubs. And really, Lake City and Gainesville are the hubs of the services we provide. So adding hospitalization, adding addictions receiving, it's the right time for this community, in my opinion. And it really is an important time for us to try and do that. This past legislative session, the governor approved 126 million recurring GR dollars to be added to the behavioral health system in Florida. Now, we certainly won't see all those dollars, but you all have before you letters of support from DCF and LSHA, Lutheran Services Florida. And I can tell you, we've spoken with folks in Tallahassee and the regional offices from DCF. They've been asking us, even before this, how can you set up an SRT? Can you set up forensic beds? It's an important cycle because there are Columbia County residents that might need an SRT or forensic beds that might end up in Daytona or Leesburg or Orlando to then be outpatient transferred back up near their home. I really think these are important services that we provide in the county. And with those additional dollars and the need, I think we have an opportunity, a real important opportunity that may not come this way again. I got to put my glasses on. And you know, well, we can't count our chickens before they hatch. We had a real tragedy in Uvalde, and there appears to be some movement at the federal level. And the first thing I heard them talking about is support for mental health services. And that's at all levels. So don't know what that's going to bring, but again, there's an opportunity. And just to give you an idea, just in this last year, this last tranche of federal grants, Meridian received 15 million in federal grants. We received, I think it's pretty coveted, a federal CCBHC grant. That's a community behavioral health grant. But what it allows us to do is provide care coordination for those that need it. I believe, Richard, there were only 11 of those that were awarded in the state of Florida. Yes, 11 were awarded. So Meridian, we're pretty happy to have that, as well as the CCBHC grant. We just applied for CMA, again, acronyms, another coordinated care CCBHC expansion grant because the needs are there. Again, centers of excellence, and I think we have an opportunity to grow. So any questions on that before I sort of get into the models? And I'll tell you, these are just my own opinions and suggestions, recommendations. What I really like to do is sit down with Dale and the team and have a conversation to know what works for everybody. So I've heard the other presentations and I've heard the asks for money. I've heard the ask for the building. You'll see some common themes here, but I'm going to go through this quick. 3 scenarios that I kind of put together, but it really is about collaboration. So the first scenario is Lakeshore Hospital Authority providing support to Meridian for Meridian at Lakeshore. Lakeshore Hospital Authority repairs the building to meet occupancy standards at its cost, actual cost. So not a hard number, but you know, what does it actually take to re-roof certain sections and fix things versus $10 million, $12 million. Meridian occupies the hospital and surrounding grounds at no additional occupancy costs between 7 and 10 years. Meridian to invest $1 to $3 million to bring the internals of the building up to licensing standards. Licensing standards, I think I've heard Dale say before, are not a small item, but we've done it before. We can do it again. We're looking at hardened walls in some areas, anti-ligature items, sleeping chairs, all the things that we have to provide. Lakeshore Hospital Authority to provide indigent care funding at a minimum for primary care and other services at your direction. We would more than welcome the authority to have offices within the building where we could send folks down the hall from primary care if they were indigent, didn't have any other way to pay, to get a voucher or some other opportunity for services and walk right back down the hall. And I tell you, we do some of that right now, and our staff go with folks. They make sure that everything's taken care of and managed. And then at the end of the lease period, the hospital building and surrounding grounds transfer ownership to Lakeshore Hospital from Lakeshore to Meridian at no additional cost. Meridian continues to grow and operate the facility. I'd like to say for another 50 years. We've been here for 50. This could be an opportunity for growth. So that's one opportunity, as I see it. Second one is a lease. Lakeshore Authority repairs the building and the occupancy standards at its cost, the actual cost to do so. Meridian occupies the hospital and surrounding grounds at a negotiated rate between 7 to 10 years, lease rate for 7 to 10 years. Meridian, again, will invest $1 million to $3 million of our money into internals for the building for licensing. Lakeshore Hospital provide indigent care funds for minimum primary care. Maintain the building to meet, Meridian will maintain the building at its cost to meet OCA and DCF licensing standards throughout the period of the lease, and will deduct those actual expenses from any lease to the Lakeshore. Deduct those actual expenses from any lease to the Lakeshore Hospital Authority. Meaning if we're paying a lease and there's a chiller unit that goes down, a significant building cost of your lease of property, take that, we'll reduce that from the lease and pay that, fix that, and get that done. At the end of the lease period, the hospital building and surrounding grounds transfer ownership from Lakeshore Authority to Meridian. No additional cost. And again, Meridian continues to grow and operate for 50 years. Last option, and again, we can sit down and discuss this. Some of the things we've seen from other folks. Meridian takes ownership of the hospital and surrounding grounds with a commitment to operate for the stated purpose for between 7 to 10 years. Lakeshore Hospital Authority provides $10 million in repairs to the building to handle repairs and contractors. Meridian to invest $1 to $3 million additional to bring the terminals of the building up to licensing standards and maintain that. Hospital Authority to provide indigent care funding. Meridian maintains the building to meet OCA and licensing standards throughout the commitment period at our cost. And then we continue to grow and operate. So I want to talk a little bit about, there's some common themes here. And one of them is long-term Meridian takes ownership of the building. My number one worry, and I can't step away from this regardless of moving forward, is if we were to stand up all these facilities within the hospital building, if y'all decided to go in another direction in 7 to 10 years, what does that do to the community? What does that do for all services we've stood up for this long period of time and grown? We can't just find a building that size or afford a building that size to slide into. And it scares the heck out of me if we move down the road and something changes and we don't, and those services fall away. So your census in your community is growing. We know the needs for mental health and substance use are growing. And if those were sort of pulled out from under the community, it would be tragic. And I can't see moving forward to grow this and have an opportunity or potential that could fall away. I hope that makes sense to you. Really, our collective goal is to better the health and well-being of those in the communities we serve. Well, these are 3 options. I think any of them in combination makes sense for both organizations. Could be the right option, but it's me listening to y'all. It's me coming up with what I think might be feasible. But really, I think the conversation's in order down the road to get to a better plan. And we just ask for that opportunity to sit down and better the communities we all serve. So I'll stop there and ask if y'all have any questions, suggestions, recommendations.
So all 3 of the options that were proposed, I know that's just 3 of them, but it says the hospital and the surrounding grounds. Have any interest for other buildings on the hospital campus, or is it mainly just the one hospital building that exists?
Let me answer this, Mr. Chair, yes. However, not at this time because we can't see our way through. But that doesn't mean, our grants person, Richard, won't come with a grant in 3 months or 6 months that we would achieve to expand services. He's really good at this. He's a guru when it comes to the grants. But, we don't want to step out too far over our skis, because remember, what we're doing here is people's lives. There's an opportunity for folks to work with us in those other buildings. We will.
Speaking of grants, one of the issues, I mean, you said we kept up with the proposals that we've heard already before. One of the things brought up last week, I believe it was, sometimes it's easier to get grant to build a new building rather than renovate an existing one. If there's property available, whether it be on this campus or elsewhere, is that something that you'd be interested in looking at doing? Or?
Typically with behavioral health and inpatient facilities, we'd have to float a bond and go that route. Remember, even the 1 to 3 million we're talking about is coming out of service dollars for the long-term benefit of the community. Meridian operates with a 3% margin. I know some of you guys have private businesses. 3% margin is not a lot up or down, especially when we have a $61 million budget like we do. So while we do look at properties and opportunities, an inpatient hospital that meets ACA standards these days is very tough to come by. Talking to Mr. Cherry from Lightstream, it's difficult. Quite frankly, without a lot of support, Mr. Chair, I don't know how we do it. That's why this is so important to us.
Where did you say some of the other locations were that have taken over inpatient?
So Aspire Health Systems in Orlando, they have a really nice hospital building, and Miss Hankey, their CEO, is a good friend. And you see it, you see what they've been able to do. Pensacola with Baptist Health, Fort Wayne, Indiana with I can't think of the name right now. Providence Center, Providence, Rhode Island. There's been any number of behavioral health agencies that have grown over time into hospital buildings for inpatient psych and other things. And it's been a fairly, this is not new territory. Oh, one last thing. So we talked a little bit about addictions receiving going to Gainesville. There's really no inpatient psych here in the county. With inpatient, it also gives us something that we can't do right now, and that's take Medicare. If we have someone that needs to be in an inpatient psych or crisis stabilization for Medicare, we have to send them out to North Florida Regional or Shenandoah Vista or one of the other facilities. Quite frankly, we're sending Medicare folks as far as Orlando, Jacksonville, Daytona, different places. And it's hard when you move folks in a crisis that far away from their family and support system.
Just to be clear, to back up, so on the proposals where it said other surrounding grounds, so at the end of the 7 to 10 years or whatever long term, you would like to have all of the buildings on the campus?
No, sir.
Okay.
The hospital, the parking lot that's connected and associated with the hospital, basically the grounds that surround the hospital building. Lined off by the streets. At least that was my intention.
Okay. What would be the timeline for implementing the proposal? When do you think it would be, if we were to say, let's go for, when would, from that point until operations?
So we started on a timeline, and there are so many variables in it right now. To be honest, to give you a hard answer, it depends on how we move forward. So we can't put anybody in there right now until the roof is addressed and certain facility things are addressed. So we'd have to contract. We have to work on the external facilities. At the same time, we would immediately start outfitting the first floor for primary care, moving over our CSU, our crisis support emergency, and that's why we put phase 1, and the addictions receiving. So that and outpatient can start right away, and then we start working on the other buildings. Again, it's already services we offer more. We can transfer license and plan or something. For the
We,
CSU?
yeah, we would be able to transfer, I mean, we'd have to have an inspection for it.
So as quick as we can get those things done, we can get signage, we could start to move those services. Including, we'd have to stand up the kitchen right away. Quite frankly, MRT in some of our programs, now that we've decided to open a 16-bed residential on our campus on Michigan Avenue, right now, those folks are without home. They're not happy about it, but they're without it. But we have an opportunity and we need to take it to house 16 people. Go ahead. Yeah. Okay. There was one other thing I need to mention. It just kind of speaks to who we are and how we operate. As a nonprofit, we can't have subsidiaries, but we are the single member for 4 other corporations called New Horizons Properties. Well, we provide mental health and substance abuse treatment. We also have 4 companies with their own boards that provide housing to over 100 people in Gainesville. And that's 4 mostly independent living facilities. We just talked at our board meeting last month, and I put it in my notes to look for facilities like that up here, including possibly motel or short-term options for folks. So coordinated care, that full continuum, really is the key. And we find innovative ways to get things done, whether it be, housing, and those housing units have been around in Wichita probably since the 80s. Yeah, since the 80s. And we keep looking at other opportunities. We just created an NHP 5, but we don't have any opportunity for a HUD property or some other property to support it.
I do.
Bear with me. I know very little about mental health issues. On the first floor of the addictions receiving unit, I think I have an idea as to what an addiction receiving unit would do. And I understand that. And I think I have a rough grasp on what a Baker Act is or the Marchman Act. What I don't have a grasp on is what constitutes a condition, or what are the conditions, a typical condition for someone receiving treatment for the short-term residential treatment. I noticed it mentioned that there were individuals that were in the forensic were involved in the judicial system. What do you treat there?
Okay.
I'm completely in the dark on it.
It's a
I'm
good
curious.
question. So I have my experts, and I'm gonna let them answer.
Okay.
I could give you, I'm a businessman. My background, actually, I'm a computer guy. My background's in math and computer science, but these guys are clinicians, and I'm gonna let them give you a better answer than I can.
Okay.
Richard.
Come to the microphone, sir.
That level of care is for those individuals who have been in our crisis stabilization unit, which we talked about in 3.5 days, who need longer term care. They would be waiting on trying to get into the state hospital potentially. But what we would do is provide the treatment there in the short-term residential, providing them with medication, providing them with the psychiatric care that they need, whereby that treatment may alleviate them having to go into the actual state hospital.
Okay.
So it's just a longer term program that would have been identified as like our crisis stabilization unit, our acute care. It's just a longer term program to try and get them the help they need in the community instead of going into the state hospital.
Okay. I'm working on it.
It's okay.
When I tell you I don't know anything, I really don't know anything.
Yeah, we worked in this all day long, and I've been doing it for years, so. We told them.
He was introduced to her and everybody's only got this picture right now. They're in the wall, like we said this morning.
Mr. Richard, could you state your full name just for the record?
Thank you. I'm Richard Anderson.
So when it says that they're they're under the, for instance, on the forensic residential treatment and their involvement in the judicial system. Expand on that. When you say involvement, my only level of concern is, and I just don't understand that. Does that mean that there's a court order that says that person is remanded here and stays here under your supervision? So my next question that kind of that pushes out to that is the security of the surrounding area, right? This is right here in our community. The question is that person being forcefully remanded under your care, under lock and key? And then do you guys have a way to, I'm assuming there's a plan to keep those people.
Yeah, I'm sorry.
If that's the case, I don't know. It says judicial. I'm curious.
I think just to reiterate that these units are locked, secure units. So just to kind of, I'm not sure that I highlighted that earlier, that the forensic residential will be a locked, secure unit. So some of the individuals have been, when we say criminal justice involvement, some of them may have been under court supervision. So yes, they could be ordered to potentially stay there, could have been found incompetent to proceed on some of their, misdemeanor charges. So they would be doing competency restoration possibly, which we assist with. If there's anything to add about that, it's
Just so work with mental health courts.
yes, we currently work with mental health court now.
Okay.
So it would be similar to that type of involvement.
In my line of work, I run into a handful of folks that have run into your services every now and again. And so I was just making sure that I was thinking about something along those lines.
One thing also is they would have psychiatric.
Oh, yes, they would have a psychiatric mental health disorder and involvement. So they would have to have a diagnosis, need for mental health treatment and services along with the justice involvement.
Okay.
And we have the ability to, go through with the record to make sure that they're not a harm to themselves or others, they're not a harm to the community. Largely, we're talking about misdemeanor charges, but associated with mental illness, that's been repetitive.
Well, and that's when you say the Baker Act, I know that's typically to prevent self-harm from someone. And so I'm just wondering how that expands out, because unfortunately, I'm in the dark on that, but I would assume that, we deal with indigent care. I would assume that there are quite a few individuals out there that are indigent that we're blending or crossing the streams here.
Well,
Where a lot of people are out there unidentified need Meridian.
Yeah, think of it this way, mental health is not a socioeconomic issue, it affects all of us. We've seen people fall, they fall the indigent care, from well-working folks. We try to pick them up before they fall too far. A big part of what we do. We also see people, and this is real tragic, we see a lot of folks enter the jail system and the prison system due to a misdemeanor or something related to their mental illness. They stole something, they punched something. But once they're in the system, it's really hard to get them out and get them treatment. Because once they're in the jail system, they may do another offense.
Yeah.
And it builds and builds and builds. As people lose their lives when really all they needed was coordinated treatment with a case manager, outpatient psychiatry. Did I say that well?
You did.
They are you, they are me, they are us. I mean, it's that simple.
And that's kind of what I was curious about, because I think what the mission, of the indigent care is it's blending a little bit more or less.
And you're all welcome to, at any time, individually or as a group, to come to our campus in Gainesville or Lake City, and we'll gladly give you a tour and give you some specifics. Again, we've been operating in this town for 50 years with much of the services that we're talking about.
My brain's cooking on the fourth. I haven't prepared my thought for the fourth floor, but I
don't want to just move on.
No, keep going. I'll bring it back up.
Rick, I have just a few questions. based on your FTEs, you're expanding services about 40% in my mind. Have you secured funding for those new services?
So for the forensic beds and the SRT, no, we don't have secured funding because we can't secure funding until we get a facility. But I can tell you that the requests are coming from both DCF and LSF, and that's those letters of support. And with the additional dollars, they ask me every week when we have a CEO call with LSF and DCF, who can stand up an SRT, who can stand up forensic beds. We can get a commitment if we have a loose commitment from y'all, we can get a commitment from them. I don't think that would be a challenge at all.
In your current primary care operations, is that mainly for your clients or is it open to the public or?
So right now, it's mainly for our clients. To give you an idea, folks with mental illness die on average 25 years sooner than someone without mental illness. And it's usually due to a physical condition that is untreated and unmanaged. Knowing that, we've opened primary care clinics. Knowing that Centene, the Sunshine Plan, which again is the largest plan in the region by far of our Medicaid lines, it's about 65%. They've asked us to put on our rolls for primary care folks with what's called SMI, severe mental illness, and SUD, substance use disorder treatment. And they've moved about 1,500 folks to our roles. And we're expanding, as we expand those primary clinics, they add that. I would love to treat the community as a whole with primary care services in the hospital. Have a distinction between one call it population or not, it's a real problem. And also, hopefully, opens folks' eyes. But we do it with fidelity and care, and having primary care is an important thing. One of the things we've seen with COVID is we've been called essential healthcare. We can't close. We didn't close through COVID. This facility will operate 24/7, 365. We were one of the first to get vaccines and to offer vaccines. And we do flu shot. We do a lot of the primary care, and we bring care coordination in to say, have you had your annual physical? You need to get in and have your annual physical. So we manage the folks we serve through care coordination. My wife can't get me to go get physical. So I see the challenge. So we work on it.
So in the funding, and so the funding you have right now is just your normal funding, you don't cross.
We do bill all insurances, including Blue Cross Blue Shield, Medicaid, private insurance, whatever insurance someone has, basically. There is no funding for indigent care, primary care. We follow the folks as best we can, and our board has decided that we continue to operate that and lose money because it's in the best interest of the folks we serve. Centene has come in and offered to pay fee for service on those Medicaid plus a PMPM rate to basically do the care coordination and manage those. But what we really like to do is work with the trustees for the population as a whole, but also the indigent care folks from Columbia County for our primary care services and to market those services out into the community.
Well,
Would it?
yeah.
Would it impact your business plan if one of the other buildings were leased for urgent care?
No, I don't anticipate that at all. If it's urgent care, that's different than primary care. Urgent care, I've been to it, and probably they refer us to as follow-up to primary care. So there's coordination there. And honestly, if someone wanted to operate primary care, they were willing to work with us in one of the other buildings, we'd step back from it. Again, we operate it as a loss. We can operate it, someone else can operate it with fidelity and purpose and are willing to serve the folks that come through that we serve. I have no problem with stepping back from primary care services, as long as we're coordinated with someone else.
Okay, the other, here's a hard question I want you. Okay, so you're, and everyone else says you're asking for a substantial amount in capital improvements initially. You're not a exclusive Columbia County serving organization. So if the building is for regional use, should other areas share in that capital cost?
Simple answer, I would agree with you, yes. Will we secure funding from some of the smaller counties? Probably not. They are fiscally challenged, as we all are, but, this really is a hub. We don't turn folks away regardless of funding. The difference that would happen, Mr. Powell, is we'd eat the dollars for primary care, for example. For the other counties, we ask you to subsidize if you're willing, the folks at Columbia County with the dollars that you have as best as you can. If you don't want to support us with other services, we'd be excited for that too. But your answer is a good one. We could certainly go to Swanee and Lafayette and Hamilton and ask for additional support. They already support us for our Baker Act dollars, which would come into the hospital. A little bit of minutia, but the state only pays for indigent care only pays for 3/4 of the dollars for Baker Act crisis stabilization beds. We have to secure the other 25% from local funds. And here in Columbia County, the county commission has been quite gracious and supportive as well, as has the other counties. But to go deeper, we can certainly ask. But I can't say what I can say one way or another.
I think basically, I was just gonna make a statement that no matter what happens with buildings and property, I know we've discussed it previously, but if we need to find a way to work with Meridian on indigent care, whether it be primary care or mental health, whatever we can do within our mission.
No, sir. The devil's in the details and we don't get involved until later on.
Yeah. One last one, just community mental health center. It's just striking me as one of the. Could you expand on that? A little bit
Community mental health center. So I'll give you an analogy.
Mhm.
So you have outpatient psychiatry. So folks have, independent psychiatrists. You have independent counselors. We provide what's called a full continuum of care. That graph that was up earlier showed, we put it up right at the beginning,
Mhm.
with sort of that piece. We provide a full continuum of care and all the levels of treatment. So think of it like an umbrella over the community. And we are the designated safety net provider for mental health and substance abuse for the counties we serve. So if you need residential, it's not a referral to another organization. If you need certain service now, don't get me wrong, we partner with a lot of folks too. We take a lot of referrals in and out, but we have that full continuum and we continue to grow that continuum within the services. But for example, if we were to lose psychiatry or case management, think of it as an umbrella with a hole in it. And we're in schools. We're in just about all the school departments as well, children's services. To give you an idea of sort of who Meridian is, well, we're a community mental health center and a safety net provider. We're also pretty innovative. We have our own software for data warehousing, and we sell it to other organizations because we know that data matters and time matters with data. We're moving faster than we've ever moved. So, we have all of that innovation. When COVID hit, I think it was March 16th of 2020. Prior to that, we were the second largest telehealth provider of behavioral health services in the state of Florida, just behind a company called Empower that's out of Orlando and pretty statewide. We went in a 2-week period from providing 40 telehealth services a week, again, the second highest in behavioral health, to 8,000 telehealth services a month within a 2-week period in March of 2020. We're nimble, we can move, we can get things done. And that's why I want to stick to the basics and the facts of what we know we can do and not get so far out over our seas, so to speak, that, we're talking in here and say, this is why we did this, is why we did this, why we did. These are things that are core to what we do. Does that help you?
Well,
And then, we also provide a lot of prevention services to the schools, to the community, mental health first aid. We have staff that are trained and provide mental health first aid for both children and adults. There really isn't much we don't do at this point from a behavioral health substance abuse standpoint in the full continuum of care. The one piece we're missing, inpatient psych hospital beds. And we use downward substitution to crisis stabilization for that, but it's needed. And we haven't, you may ask, why didn't we stand up in Gainesville? Well, you got 80 beds with Chance Vista. You got 40 beds, and I think a new hospital being built out off Archer by HCA North Region. There's that continuum of beds. Do we really need to add more at that time?
Questions?
I can't help myself.
Yes.
I'm an accountant, you can understand. Okay, so you have 3 proposals, and I'm trying to figure out the difference between 1 and 2. Down 1, the Lake Shore does just what it needs to meet occupancy standards, which has come up with 6 million.
So we took on our own engineering report just in the last 2 months. We've been struggling. We were able to get a draft just this morning, and from the numbers, and I caught Dale before. When I look at the engineering reports, the detailed engineering reports for 17 and 18, there was some opportunity for reflashing. There was some opportunity for changing pitch and some other things. Our report came in somewhere around that number. And what it is replacing some roofs, repitching some roofs, adjusting some of the drainage and backup drainage for some of the roofs, but not to replace every roof on, what is it, 57,000 square feet or some number like that. Does it make sense to replace every single roof if some can be reflashed, recoated, redone? Would I love to do it and start fresh? Sure, but that's a significant amount of money.
So under that, did the authority spend 6 million? There's no monthly annual lease. At the end, the hospital's transferred at the end of whatever it is, the early period.
Whenever we can agree, yeah.
The next one.
Well, on that first one though, you notice I put actual costs.
Yeah.
The question there would be, would the Lakeshore Authority want to and be willing to get those roofs up to occupancy standards yourselves and actual costs? Not, we need X amount of money. What's it actually cost to do it? And then y'all pay the bills to get that building up to speed.
Okay, and then your option 2, which seems like the same proposal except it's on a KS lease.
I can't hear you, Mr. Beal. Can you speak up, please?
But then they take off any maintenance and repairs.
Yeah, so in that second proposal with a lease, I mean, it's at that point, it's your building. What we would say is, get it up to speed. We will put money into it, 1 to 3 million, or what it takes to get to licensing standards on the internals of the building. But my thought then is if you have a large chiller that goes down or a real big expense, and we're leasing, what I'd say is we can or you can fix it, but let's take that amount off the lease that we pay. So we're not paying for a building we don't. That's really all I suggest.
And then option 3 is just for the authority to give you $10 million.
And one of the proposals I've heard to this point.
And to not collect lease or to.
Yeah.
0 lease or have lease.
I think it's 0 lease. Yeah. And again, we really like to sit down and find a collaboration that works for both the trustees and for us.
I understand the.
Yeah.
Okay.
I was just trying to think of options. Y'all have asked for options, and just thought I'd try and put out there some things that we could mutually agree on, and it could be a combination of the 3. The long term, all these services once they're from under the citizens of Columbia County and the region.
So then before we've got to switch the tape over, so it'll take. long?
3 minutes.
3 minutes. 3 minute recess.
Yeah, switch the tape over to a Jersey.
What's up, man?
Doing all right? That last question.
I saw
This is almost over. They're changing the tape.
Brian? I'm sorry.
Amen.
Some help. Oh,
All right. Go ahead and call the meeting back to order. What is there anything else as far as the presentation?
No, I appreciate the questions, and honestly, we love the opportunity to work with y'all and collaborate.
Any other questions from the board members, staff? This time we will take public comments. Just a reminder that public comments are comments to the board, not a question and answer session. Presenters or for the board. Any public comments from inside the room this evening?
Thank you. Hello, Columbia County Observer and resident of Columbia County.
Please go to the microphone, sir.
Is the microphone on the stand?
Yes.
This is my tape recording. I come prepared. Two of them. Thank you very much, Mr. Chairman. Stu Welker, Columbia County Observer. I just have one question. You can choose to answer it or not, or actually it's from Meridian. A couple of times tonight, it was mentioned that Meridian doesn't take Medicare. I was just wondering why and why that would not make a difference if they took the hospital and used that as a Meridian hospital. That's what I asked. So you either ask them to answer the question. You could ask the question. You could dig in and refuse. But usually. The other thing is, I've been going to meetings for decades. No excuse what this board does about not having this material beforehand. There's no reason that Stephen Douglas should be having a thumbed through a last minute presentation, which I ended up having to send to the board because it couldn't be printed, and I put the page numbers on. So this stuff needs to be required in enough time that the governor's board, and that's 1, 2, 3, 4 people, have time to review the information so that the governor's board can review it and ask questions without throwing up their hands, not having time to prepare. And I can understand the throwing up the hands part, but it's just, in this day and age, it's inexcusable. And this is not the first time this has happened with the Lakeshore Hospital Authority. You're the board chairman, you're the boss. If the hospital authority manager, the staff can't get the stuff done on time or put on the internet on time, then you're the person with the solution. If you want to continue to drag your feet, then that's a pretty good storyline, being that you're sitting on 20 million and blew through $2.5 million already. And you can shake your head all you want, but those are the facts. This is the way it went in Columbia County for a long time, and this needs to stop. So my question is, again, why Meridian doesn't take Medicare? And if they took over the hospital, if they're not getting it now, what would be required for them to capture Medicare? Which obviously would be a benefit to everybody. Thank you very much, Mr. Chairman.
Thank you, Mr. Wilker. Good comments, Mr. Ward.
Mr. Sheriff, board members, I'm not here this afternoon to admonish y'all for the way that y'all conduct business. But I do want to take my time, if you don't mind, Mr. Chairman, and really express myself as it relates to the community, as it relates to the proposal that has been presented before us, and my passion, also concerns, if that's okay. Sylvester Warren, the third for the record, lifelong resident of Lake City, Columbia County. I'm the third. My son is the fourth. My grandson is the fifth. We're all born over at LSHA Hospital. I was a person that was very passionate about making sure that a full-scale hospital came back to the Columbia County District 10 area. Most people consider me or call me an activist. I think I really like the terms that the state attorney used about me over in federal court last week, that I'm more of a community organizer. And so what I've been trying to organize is to get a hospital back. Well, I've come to the realization and talking to different people in the staffing business, staffing about 400 nurses throughout DOC and other facilities, and talking to Mr. Williams and other people, the likelihood of that is not going to happen. So I've gotten over that aspect. Then I take another look at my community and I say, okay, what would have the best and most positive impact for the community? This community has been neglected. District 10 is predominantly Black community. It's the poorest community on the totem pole and in this county, other than 5 points. And so that's a concern of mine. And by the way, I still live in District 10 because I choose to, not because I have to. And so, and we want to change that, not just myself, but many people who work alongside with me. And I'm passionate about mental health. And I'm gonna tell you why I'm passionate about mental health. The day of my birth, shortly thereafter, my mom was diagnosed with a lack of mental health stability, which is paranoid schizophrenia. And so she has been under the care of Dr. Montre all of my life until Dr. Montre just recently retired. I've been around ALF since 4 years old. My grandmother retired from the Clinton State Hospital. My mom has been there before. She's a lifetime back and forth at Meridian. Her name is Joanna Warren. And so she's also been to the Vista facility over in Gainesville. So very familiar, very passionate about mental health. Love for the opportunity for mental health to be more recognized, more money, and more service. But for me, it is about where you put those type of facilities. Where do you find the real estate, and what's the best place to deal with that type of issue and that type of facility? I personally, and all my passion for it, do not find, as I listen to the proposal and I've done some of the research and I've listened to some of the presentation and I've heard from other people, that it has different components to it. It has a component that talks about drug rehab, drug treatment, and it includes 7 counties. And what you're getting into is treating people with different drug addictions that we currently don't probably have in Columbia County. The last thing you want to do is get somebody here that's hooked on heroin, because we don't have a heroin issue in the Black community right now, right, to a high level. But we do have a lot of crime that's taking place. If you look at social media, you look at everything that we talk about, that we got the shooting and we got the drugs. Where is it heavily concentrated? District 10. Where is it heavily concentrated? Next to LSHA Hospital. My fear, my concern is if you bring a facility similar to a state hospital that's treating people for drugs, all you're welcoming is people who are looking at the drug trade and saying, how can I make my next buck? And where's my next set of clientele? That would be a 7-county clientele. And I had to argue with the commissioner in my district, and he asked me, what would be your expertise to say that that would happen? Well, I have a past as well. And I was a former drug dealer. And if you put a 7-county drug treatment center here, if I was still in my former days, I would go right up that street and buy up every house and turn them into trap houses. Trap houses is a Black culture term. If you ain't in the drugs illicit business, it means it's a house where you can go and buy different drugs. And I believe if that happens, I'm more than certain, because I am still connected to people that are part of the street community. And that is what you would have. And it would be worse in this community. And I tell people all the time, and I don't mean any ill will by it, it's just the fact of the matter. Anything that my white counterparts, and don't take this the wrong way, it's a fact, don't want in their neck of the woods, they think it's okay to shove it in our neck of the woods. From the railroad tracks to the power plants, to the waste control, to the landfills, anything that's not okay, presentable and proper and kosher with my white, they don't want it. Just put the land out on West 90, put out there by Nick Potato. Let them, when they leave there, they can go get a hotel, they can stay there at Nick's place, they can go eat at Chick-fil-A. Why we can't put it out there? So that's my attitude, that's my concern. And it's a real concern, not based on some hypothetical, based on experience and based on facts of what would take place. And it would be mayhem. And there's a lot of people, unlike me, that they'll talk to y'all behind the scene. Commissioners, elected officials, people from the downtown corridor, they'll call you in private, but they're cowards about coming up here and standing up for what's right. I'm not. It's a good meeting program, but I don't think that that's the right location. I support the concept. I 100% support the concept. My mama had mental illness. Support the concept wholeheartedly and be willing to do anything else, find them other property, find them other things. My girlfriend is the only Black licensed broker ever in the history of Columbia County. We'll be willing to give all the resources that we personally have to put it somewhere else, but just not in District 10. And I heard you say, Mr. Chairman, that we got to find a way to help Meridian. Don't know what you mean by that statement, so I'm not going to try to read into your mouth or into your mind what you meant by that. But I would hope that when you said that is about helping them find a different location. I'm not going to lie, and you know me, and I'm not going to wave on what I say and what I'm doing. And I spend the money and I do it, whatever it takes to do what's right for the community in which I'm born, raised, and have been neglected and need to be defended. Then we would pack this house. And you will see a protest, and you will see things in this community that you've never seen if you try to bring a state hospital and a 7-county drug rehab center here, when I'm already working day and night with a police department that's not sufficient. All right, the police department is not reacting to the crime that's taking place in this community on the gun violence and the drugs, and then you're gonna bring more burden on this community by putting in a drug treatment center. That makes no sense. And so I would ask that, yeah, let's sit down with Meridian, let's see how we can help them. But I do not think that giving up the property to the LSHA Hospital is the route in which we help to solve this issue. I think there's other alternatives. I think we're all smart. I think we're a community who love people who have issues. I just think that we just got to put our heads together and figure out when, how, and where, but not there. Thank you.
Any comments from inside the room? Comments online? Ms. Limley.
Good afternoon. I appreciate the presentation. It's been over or almost a year when I questioned the legality and makeup of this board. The enabling legislation states that one member of this board shall be a practicing physician at the hospital. There is not a hospital and there has not been for almost 2 years. Therefore, I feel this board is a illegitimate board, and this board has not had the board attorney to contact the Attorney General's office to ask if they're a legally constituted board. The other point is each of the entities have asked for money for our dinosaur, and there's an estimate of 6 million, 10 million. However, it could be 12, it could be 20 million. And renovation is not an easy project to do. And as Barrett said in his previous presentation or prior presentation, the state doesn't like to really give dollars for renovation. They'll give them to build new buildings. And I think this board needs to make the decision to give the building away, demo the building, but not put any money into a 50-year-old dinosaur. And this board needs to, at a future meeting, ask for an AGO opinion if you think you're a legally constituted board. Thank you.
Any other comments? See none. Swins, do you want to discuss the next meeting? We had one advertised for Thursday the 16th. Is that correct?
Thursday, the 15th, but that is now canceled. That is not possible due to advertising requirements and et cetera. The next scheduled meeting date that we had was June 23rd. Now, there was one conflict on the 23rd. That was with Fred. Fred won't be able to attend, but I don't know that you're going to need an attorney for that meeting. But your next meeting is to try and take what you've learned to this point, and at some point, we've got to start narrowing down what you believe the options of the authority are or should be. I will remind everyone the process that we followed to try to get to this point is staff's belief is that if you can find your tenant or you can determine what use the hospital will play, the actual hospital, everything else becomes a lot easier. Because you have a lot of proposed uses that don't need more than 1 or 2 offices, not entire buildings. And it is that building, which of course is the financial drain. It is that building which has the largest amount of concern that you're going to have to make in determining what to do with it. So you've now heard from all of the submitters of proposals that have a plan for the hospital. You've heard from all 3 of them. And I do believe that if you can sort of start directing of those proposals, which one we need to start more fine tuning, which ones we should pretty much concentrate on, everything else will start to fall into place. And just to remind you, those other themes include urgent care center, which was mentioned, Medi Specialist, which is looking to expand. They're currently located on the west side of town. You have some governmental office requests. We have some chances to work with our public health unit, again, in the primary care area and also in the dental. We have some religious organizations that would like to have space provided, all of which can potentially work together or to support one another. But I don't see any way in which to help you determine the best solution until we determine what's going to become of the hospital. And if you have a differing opinion, please share, but I just don't see any other way to do this.
So we're good for the 23rd.
We're good for the 23rd, and just understand you will not have legal counsel here. So any legal question that comes up, we will have to, log and defer, and you'll get your answer later.
Any further comments?
Or prior to, can we
Absolutely.
confer with you on that, to confer with legal counsel?
Sure, yes. Any questions that you may know in advance that we can present, I'll be more than glad to do so. And that also includes questions to Mr. Powell.
Correct.
All the hard ones go to him.
5:15.
Comments? Motion to adjourn.
Motion adjourned.
Second.
We're adjourned.